Good day. My name is Dr. Mati, and today I'd like to share my experience with glucose intolerance, how I got diagnosed with glucose intolerance, and what I did about it, and what has been the outcome of the actions that I took. I've managed a lot of patients, even though I'm a surgeon, I've managed a lot of patients with glucose intolerance and diabetes because optimizing glucose is a key part of getting good surgical outcomes. And so, for patients that are in my care who need surgical intervention for one reason or the other, understanding and managing their blood glucose is important. I never thought that earlier stage in my life I could be diagnosed with this condition. Actually, it came as a coincidence when, upon completion of my membership examination, when I was a junior specialist, I applied to join the Ghana Armed Forces, and during the medicals, it then came up that my blood sugar um, was high. So they checked the glycated hemoglobin, and I remember a figure around 7.1, which clearly puts me in the diagnostic criteria as diabetic. But it hit me so hard, and I elected to go to a reference lab and repeat it. And it came to just about the same figure. So, because of that, I didn't make the cut for the medical uh, recruitment process for the Ghana Armed Forces. But I took on the challenge of learning to deal with this condition and then turn it around into something positive. And that's what I want to share this afternoon. So, today, what I'm going to tell you is quite an experiential one. It's a personal journey that I embarked on, and I would like to share the success and the challenges that I experienced during this journey. So, in 2016, I was diagnosed as glucose intolerant or borderline diabetes. So my sugar was fluctuating between 6.1 to 6.9. And I think that, you know, going through my memory, um, they were quite accurate with the diagnosis because I could identify with periods in my life where I had glucose hikes. I used to take a lot of energy drinks and simple sugars and refined carbohydrates, especially during my medical school days, especially the final year medical school days, and also during the house job and residency period. Some of the meals that became very much staple in my life was white rice, you name it, every branch I was on it, and energy drinks largely. I didn't really distinguish between healthy and unhealthy food choices. I just ate based on how I felt. If I was hungry, I just ate what I had. And that's really did take a toll on me. So when the diagnosis was made, I checked into the diabetes clinic so they could saw the dietitians and then told them why I was there. So they took me through dietary counseling. They gave me a sheet itemizing the portions and types of meals I could take and what I should avoid. And this material turned out to be quite useful. I actually embarked on an internet search and added more information to sort of expand it. And when I went to the districts, hospitals, to start my surgical practice as a specialist. I took it there and made photocopies and then made it available to the diabetes clinic within the hospital under my care. And so that became a template by which dietary counseling to be done. So specifically, what did I do? Initially, my weight was around 86 kilos. Then, that's around 2016. My blood pressure revolved around systolic of 150, diastolic of 90. I used to fatigue very easily. I suffered multiple conditions which usually, ordinarily, would have been dismissed as normal ailments of life. But today I'll be very, very specific in telling you what I experienced, which was in keeping with high blood glucose. So I'll start top down. Top was my hair, the quality of my hair, the texture reduced, became more and more pale in the appearance. For instance, eyebrows, I had folliculitis at my eyebrows, folliculitis around the margins of my hair, especially the posterior aspects, also or the scalp. I developed blepharitis. So usually any part of the body where you have hair growing, you can develop folliculitis. And this can be very painful in your nostrils, your mustache, your chin areas, the armpits, the groin areas, the legs, you name it. Once there is hair growing in the cutaneous part of the body, you can develop folliculitis. And this is actually a bacterial infection. Sometimes, even without intervention, some of these eruptions, they appear like painful pustules, would just resolve. And sometimes you have to take antibiotics. So let's say for the cutaneous head-bearing areas, that's what happened. Specific on, let's say, my face, I developed what we call tinea capitis. Some like patches of flaky fungal infection on my scalp sometimes, and commonly on my face, especially around the hairline areas, and then the nasolabial fold areas, very itchy and appearing pale, and we have excoriating dermatitis, and it can sometimes scratch it so much that it gets inflamed. And you can actually also see like circumscribed lesions of fungal infections on the face. And this is just not the face, but I'm just going from top to down so that I don't forget other parts of the body, especially the extremities and my legs. I had these patchy islands of fungal infection called tinea corporis. Then to, let's say, the lips, I developed cold sores, and cold sores can be very painful. People develop cold sores when they develop flu or some transient viral infection, when they develop malaria or some acute illness. All right, so I developed cold sores, and this is quite frequent, very, very painful. So usually around the corners of the lips, sometimes you develop it somewhere, the lower lip or upper lip. Then in the oral cavity, I developed very painful pharyngeal tonsillitis. And this usually will cause your temperature to rise to around 38, 39. You'll be very sick for some days, making swallowing and eating very, very, very difficult. Very, very difficult. On the tongue, the lingual tonsils usually gets enlarged and very painful. I developed viral sores, shallow ulcers on the tongue, and this will come resolve on its own. And you literally just didn't do anything, or you realize that it's gone. The inner margins of the lower lip, I developed very shallow, very painful ulcers, which also resolves every now and then without any particular intervention. On the mucocutaneous areas of, let's say, the head, specifically the conjunctiva, let's say the middle ear, the oropharyngeal area, I developed very itchy conditions, so that it is you always have to do tuck your oropharynx in, and as though you're scratching the back of your throat like this. And it can be very disturbing. It can be so disturbing. My eyes, the itch was so terrible that I could rub it, and it developed conjunctivitis and causing me to buy glutate ciprofloxacin to apply and sleep. Sometimes it can be so painful from the scratches that it became very inflamed and I couldn't even open them. So for the mucocutaneous area, these were especially for the head region. These are some of the ways that high blood sugar increases can cause you to develop. It presents something like an allergy, even though you are not specifically allergic to anything. But thinking back, I realized that it was during the high blood sugar hikes that I experienced this. And this coincided with periods where I ate diet very high with high glycemic content, especially like fufu or banku or, or white rice. And that really caused this terrible itch of the oropharynx around those times that I consumed high glycemic index foods. On the eye, I developed two conditions. One was blurring of the vision. I couldn't drive at night. So obviously, I was maybe developing evolving cataract of the lens. Luckily, this usually tends to be reversible if it has not advanced. So these osmotic changes, I later on came to realize, is as a result of the accumulation of glucose within the lens, and this gets converted to sorbitol, and sorbitol makes the lens become gradually opacified. So cataract in diabetes, that's how it tends to occur. I also developed challenges in accommodation. So for instance, if I was looking at something this close and I had to quickly adjust and look at something in the distance, it took longer for me to develop a sharp central vision when I switched from looking at something close to something in the distance. So this delay in the accommodation of vision was also a challenge. I developed photophobia. So for instance, if I move from a dark room or a poorly lit room to the outside during the daytime, I had to sort of cring and protect my eye because of the pain I developed when exposed to bright light. And this is all because the protective mechanism within the eyeball to sort of regulate light from excessively entering your eye. All these are controlled by smooth muscles. And because increased blood sugar can cause some impairment of the smooth muscle that regulates the amount of light that enters and leaves your eye, you tend to be flooded by excessive amount of light when you move from a dark area to a light area, and that can cause you discomfort. So that's the photophobia. There were times I developed what appears to be like little spots of light in your vision. It appears briefly, lasting, let's say, 5 seconds, and then resolves. And later on, I came to hear that that could suggest retinal detachment, and that was quite a scary phenomenon for me. I also developed retroorbital pain, severe, intermittent, episodic, retroocular pain. You feel like there is this needle being driven into the back of your eye. It's very difficult to localize. You just can't know where the pain was, but it comes in sharp waves and then resolves. I also developed, I'll say, temporal arthritis. The temporal artery here got very, very painful, and it gave me hemicranial headache sometimes, and it also resolves on its own. It was so bad that sometimes it even gives me pain and mild inflammation of the ipsilateral eyeball when that episode of temporal arthritis occurred. There were times that I had, what do you call it, dizziness and vertigo, especially if I took drinks very high in glucose. So, for instance, if I was moving my eyeball from the left quickly to the right, it took a few seconds. There was a little bit of lag in the extraocular muscles adjusting and moving my eyeball. So you tend to have what looks like horizontal nystagmus, and it was very uncomfortable. So you realize you're looking at something to your left or maybe something to your right, and all of a sudden you get distracted and you quickly turn your head, and then your eyeball is lagging and it's not adjusting enough to help you to have a central vision when you have moved your head. Don't know if you understand what I'm saying, but that was my experience. So with the eyeball, it was quite stressful. I was banging my car into speed ramps, and nearly developing experiencing collisions because I couldn't see. And especially, I'm very much fond of driving at night, especially during long distance travels. And it was becoming increasingly difficult to times that I had to even lean out and look at ahead of the road. And it came to a certain point I had to really stop driving at night. But now all these conditions have improved and reversed, and I don't have that. I also experienced seeing halos around bright light. So, and this usually does happen more when you, for instance, you try to read of prints in bright light. You see this blurred halo around writings and also around light itself instead of seeing it sharp. So I experienced that. And then the other thing too was floaters. My floaters got worse. I've got floaters. I noticed during sixth and seventh year medical school that there were floaters in my vision. I went, got my eye checked. They said my vision was fine. But the floaters got worse over time. And this one, working back, I came to understand that it was due. Well, I attributed it to the glucose hikes in my bloodstream, and found out that in diabetes too is a condition that can occur. So that's on the eyeball. The central vision was fairly okay, but if it's I receded beyond a particular distance, reading from the television was a little bit of a challenge, but that also improved subsequently. With regards to my, let's say, chest, okay, I developed disturbing cough for a long time. I was expectorating, greenish, yellowish sputum, wasn't feeling feverish, didn't develop frank pneumonia, but somehow for so many months, I kept coughing up yellowish sputum, sometimes with a tinge of green, and I just didn't understand why it was so. I occasionally developed precordial pain, which was intermittent and sometimes led to a transient discomfort in your breathing. So I'll be there, then develop sudden episode of transient tachycardia, and then there will be about 3 second cessation of heartbeat, causing you to feel breathless. And it's just brief. Then your heart sort of beat becomes restored to normal spontaneously. This happened several times, and for a reason I just didn't understand, and I got checked. Nothing much was seen, and but now it's normal. And I'm only just sharing it because it happened at the time when my blood workup was not good. And that is why I'm just sending these, bringing this across, so that in case you also identify with some of these symptoms, you could share your experience. There were times that, yes, I forgot, on the oral cavity, periodontitis, okay? Oh, this was very, very, very uncomfortable. So around the teeth and the gum, the junction of the teeth, the enamel and the gum, usually find this uncomfortable, unsightly, greenish yellow concretions. And no matter how hard I brush my teeth, twice a day, these concretions were there. And also on the cusp of the molars, premolars and molars, I found these dark concretions, which sometimes I had to, scratch off with a needle or something hard just to get it off. But somehow it does come again. And then I could also bleed very easily from the gum margins during brushing of my teeth. And this went on for so long. I thought, oh, probably I'm deficient in vitamin C. So I was just taking tons and tons of tablets of vitamin C without any improvement. But subsequently, when my blood sugar improved based on diet and exercise, all these things, these periodontitis, gum bleeding, and concretions on the cusp of the teeth, all disappeared. I didn't have to brush extra hard, and even the quality of my teeth in terms of appearance, all these gum pains resolved spontaneously, and I didn't bleed on brushing my teeth subsequently. It was interesting that even those days that I switched to using soft toothbrush, soft bristle toothbrush, I still was bleeding during oral care. And now I use like relatively tough bristles and I still don't bleed. And so it was clear that the fragility of the vessels and the inflammation of the gum was largely due to the increase in blood sugar, causing bacterial or fungal cause of periodontitis to cause this condition. So that's what's the oral mucosa, and you realize that your breath wasn't that good, especially in the early mornings. Everybody has bad breath in the early mornings, but if your blood sugar goes up, it tends to be terrible. Your sinuses will get inflamed very often, especially the frontal and the maxillary sinuses. So they don't drain well. And all these things can contribute to halitosis, which can be quite disturbing. With regards to my joints, oh yes, I developed very terrible joint pains, especially my shoulders. There were times I couldn't lift my shoulders above the level of, let's say, my shoulder joint. So I couldn't take it up like this. And the pain was far more worse on the right. I realized that the contour of my shoulder had sort of reduced. The muscle bulk has reduced. And the bulk, and that gives you the normal, rounded, nice shoulder contour, was reduced. And I was an avid trainer. I went to the gym quite a lot, and I was surprised that even though I was lifting weights, I just couldn't deal with this condition, and I didn't know better. So later on, I realized that much of the contour of the shoulder was as a result of the reduced tone of muscle, the global reduction in tone of muscle that is usually associated with increased blood sugar. And now the muscle bulk is back, I don't go to the gym. I train calisthenics. I do push-ups and core strengthening exercises, and my muscle bulk is back, and the shoulder pain is completely gone. I'm able to elevate my upper limb beyond the shoulder joint, and I don't feel any pain or that's premonition that your shoulder joint is even about dislocating. I don't experience that anymore. I also experience severe low back pain. My low back hurts like crazy. Nothing could fix it. Not analgesics, nothing. And I largely attributed that to weakness of my trunk muscles and the twisted architecture of my trunk muscles. I developed protuberant abdomen, so of course it puts my low back in an exaggerated flexion. And when I lost a lot of these belly fat through exercise and diet, and did core strengthening exercises of my core muscles, I all the pain in the low back also resolved. So that's really gave me reason to be very happy. There were times, especially during membership training, I am very in tune with doing dressings of my patients on my own. I like to open surgical wounds and inspect them and do dressings. And this was becoming more and more of a challenge. At times I had to put my knee on the patient's bed just to support myself before I could remove the patient's wound. And bending to pick something on the ground and rising was very difficult unless I supported my trunk by holding onto my knees. This was how bad it was. And um, currently, I'm 43 going to 44. So I'm talking about these challenges were like 8 years ago, right? So you can just understand as to the kind of challenges I was experiencing. It's not like I'm advanced in age that much, but again, you can still be young and develop severe low back pain and not understand why it is so. So that's really very much was much of a relief when all the pain and the discomfort resolved with diet and exercise and improvements in the tone of my core muscles. I developed knee pains, and this can alternate. It can be the right knee or left knee, especially going up a staircase. You have this severe pain that just won't go, and you just don't know how. I developed pain around the ankle joint that you just couldn't put a finger on. I developed this severe pain in the mid arch of my foot, and it can either be the left or the right. You somehow felt like there was this tearing pain in the mid arch of the foot during standing, and this affected how I stood during surgeries. I had to shift my weight in my posture, alternating to stand on, let's say, my heels or the lateral aspect of my foot just to shift my weight off the mid arch. And I came to understand later on that it was because of the weakening of the intrinsic muscles of the foot. And this would lead to unequal weight distribution, causing the arch of the foot, which is meant to support your weight, that arch gets weakened and it leads to a partial collapse. So the partial collapse of that arch and the stretching of the tendons, especially the plantar fascia, can cause pain. All these have resolved completely with control of my blood sugar as well as with exercise. And that is for musculoskeletal bit. With regards to other, say, vascular problem, I talked about the heart. I experienced some form of erectile dysfunction, but it wasn't too bad. It was episodic, just on few occasions. And it did surprise me because I was wondering what I could be doing wrong to experience some erectile dysfunction. And this erectile dysfunction completely resolved on no drugs, just for diet and exercise. There were times that I developed, you have a very painful crack in your, a painful crack in the crack of your gluteal region, that small part. And it's also resolved without any medical intervention when I control my diet and my blood sugar. So later on, I came to see that most of these problems, like the erectile dysfunction, that painful cutaneous crack in the crack of your gluteus, and some of the cramps in the calf muscles, were all as a result of that the vessels going into spasm, or some atherosclerosis or atheromatous plaques building up. So once your major vessels get involved, then your cutaneous branches also get involved, and then you develop these painful conditions. So these are some of the things. Now with my digestion, it got so bad. Anything you ate gives you butterflies. So you have your abdomen rumbling, you are full of gas, you easily have the urge to break wind. And my understanding of this is that once the luminal secretions get increased, your blood sugar, when your blood sugar goes up and your luminal intestinal secretions, the sugar content also goes up. It leads to fermentation, and fermentation leads to the release of gas. And it gets usually worse with certain meals like beans, and cabbage, and eggs, what have you. Yes, much as these meals will cause you to have gas. Now I don't experience this bad, uh, gaseous bloatedness that previously I got. So the same meals that gave me very bad gas, and meals that shouldn't have given me gas, like maybe if I ate white rice, I got gas. If I ate bread, I got gas. Now I don't experience that anymore. Plus, I don't eat any of these low fiber, highly refined carbohydrates anymore. And that has led to the resolution of this bloated feeling and the sensation of gas in the gut. On the peripheral nervous system, I developed numbness and pins and needles in my toes, especially the lateral aspect of the toes. Okay, and it just like that. It's very painful, and sometimes it's resolved. Sometimes it comes. Okay, and that's how I forgot athlete's foot. Okay, in the web space, especially that last web space. The last but one web space. So the third web space. That's the popular place that you develop athlete's foot, and it can be very offensive. It's so offensive that I remember a patient who shared experience with me, saying that he sat on the bus and removed his shoe, and somebody actually complained in the bus of the smelly shoe, and he was forced to put his shoe back on. And that's how bad athlete foot can be. It can resolve using antifungals, it can resolve without any intervention, but it goes and it will come again. And later on, thinking through, I realized that it occurred during periods when my blood sugar was up. So even with glucose intolerance, doing nothing, you experience fluxes in your blood sugar. So when your blood sugar goes up or your insulin resistance goes up, then it will lead to spillage of glucose into your tissue. So it can lead to the eye symptoms I mentioned earlier on. It can lead to passage of large volumes of urine. And I forgot that. I passed large volumes of urine. There were times when I was doing PowerPoint presentation as a resident, I had to stop mid-presentation and go use the washroom. And I led myself to accept that because I was taking large volumes of coffee, it was the coffee that was promoting the diuresis. But of course, I was taking caffeinated drinks like the blue jeans, and the rest, 5 stars and what have you. And all these things, apart from the caffeine, which will cause diuresis, the sugar content in these drinks also caused my sugar to go up. So I was getting osmotic diuresis. I got all the symptoms. I developed superficial carbuncles, sometimes pustules in my thighs, which some of them resolve on antibiotics and the like. So, um, come to think of it, if there was a symptom associated or a sign associated with diabetes that is documented, I developed it. Just that I was fortunate to have been diagnosed early with the glucose intolerance, or what we call borderline diabetes. And most of these things that I mentioned are completely reversible when you put yourself on a diet. And when I say diet, it means one, you are cutting back drastically on refined carbohydrates. Refined carbohydrate is carbohydrate that the body digests very easily, especially, for instance, is polished rice. And then fructose. Fructose is also another horrible source of glucose that can cause your liver to become fatty, can lead to insulin resistance, and can lead to blood sugar hikes. And people usually find it quite surprising when you tell them to lay off fruits, when you are giving dietary counsels. But that's what, in fact, I didn't think of fruits as a disturbing source of blood sugar increase, because I was eating a lot of fruits back in the days, slicing banana, watermelon, pineapple, the big mangoes. I was enjoying all that, and it was causing terrible, terrible symptoms when I ate all those things. So now that we've seen all these symptoms, and I'm sure I've left out a few that has escaped me, but I've mentioned quite a lot. Now that you've gone through all the symptoms and some of the signs of increased blood sugar, what did I do? I started jogging. I had to lose weight. I was 86, now I'm 69 kilos. So that was a very significant drop in weight, 86 kilos to 69. So I lost all that amount of weight. Two, I restricted my diet to mostly protein, which is animal protein, vegetable protein, and vegetables. Okay, so the proteins could be fish, egg, lean meat, right? This, and the vegetable protein like beans, the lentils, and I use these sources to prepare my meals. So for instance, a lot of what I take predominantly is bean stew. That's what I usually take. And I also consume eggs and cabbage, cucumber. These meals give me bulk, and they are low in glycemic index. It doesn't cause rapid increase in blood sugar. And so that has been my staple largely for quite a while. I also am indulging strength training exercise, weighted exercises. Usually you have to find time, go to the gym, which I don't usually get time to do. But I do a lot of core strengthening exercises like push-ups, right? And both the horizontal and the incline, the varied forms, the diamonds, I do all that. So this has improved, one, my chest architecture in terms of muscle bulk. It has improved my tone of the rectus abdominis and the trunk muscles. And it has even helped correct my posture, because previously I used to slouch forward when I sit. And it's all because of the weakness of my trunk muscle. But now I usually sit squared up, and it has really improved even the period I stand to do surgeries. And I can stand for longer hours. So the diet, and you see the response of The blood sugar and your diet, it has such a parallel relationship. Whatever you eat will easily cause either your blood sugar to go up or remain at a plateau and the like. So for instance, if you took, let's say, fufu or white rice, 2 hours after that meal, if you are glucose intolerant or diabetic, and you check your blood sugar, it will be increased. But if you took, let's say, an appropriate amount of beans or fish or egg, and you check your blood sugar 2 hours after, you will not see a significant increase. So there's a clear reason to make a switch, alter your diet in order to be able to control your blood sugar. Exercise does not do everything. Dietary contribution, to me, it's about 80% of the work. 80% do the diet. Exercise helps in activating your fatty cells, your muscle to sort of take up your circulating blood glucose. But if you look at blood glucose, uh, usually they are from two sources, maybe it's three sources, maybe from glycogen breakdown from the liver to produce glucose, gluconeogenesis, the liver synthesizing glucose from non-carbohydrate sources, and then dietary, what you eat that gets digested, and then your blood, it gets absorbed into your bloodstream. And of all these three, if you look at the body's production of glucose from glycogen stores, it's quite limited. Within a day of fasting, all your glycogen stores are depleted. And gluconeogenesis is more of an endogenous process, so you can say that it's highly regulated. But dietary glucose, because you are pouring into your system, and if you are disinhibited with how much you eat, you don't regulate how much you eat, it can really cause your blood sugar to go up. So that is why, of these three sources, what you really have much control over is the diet. What you put into the body really contributes a lot to your glucose increase. There will be a time, you don't have not to make this video too lengthy. I'll find another video to talk about the dietary adjustment that you can make and go to very tiny details in terms of what I do to give me the success that I enjoy. Currently, my blood pressure, I earlier told you, was somewhere, previously was around 150/90. Now I do like 170 or 180, or sometimes even 90/65. No medication, nothing, just diet, and that's all that I've done. And my fasting sugar and even postprandial sugar has been hovering around between 5 to 5.5, thereabouts. Even after eating, 2 hours after I check my blood sugar, it's still quite within normal range. And my fasting sugars hovers around 5.1 to 5.5, thereabouts, which previously wasn't so. I've had periods where my fasting sugar was 7 plus, 7.1, 7.2, 7.3, thereabouts. And so that tells you that the measures you put in place to deal with your blood sugar, even when you are full-blown diabetic on medication, diet still plays a very significant role in helping to control your blood sugar. So I would bring this talk to an end, and later on I'll prepare another video that talks about the specifics of the diet, and maybe I'll put in a word or two about the exercise regimen. It's not much of a big deal, but the dietary bit to me is big deal. I'm not saying it's not, I'm saying it's not a big deal because these goals are achievable if you think about it, that whatever you do has an effect on your blood chemistry. Then you think that way, you are more motivated to put in your best. So in my subsequent videos, we'll talk about food addiction and how to go through proper dieting, intermittent fasting, and other useful material to help